Well, June is Men's Health Month. Although men are generally known for not being in favour of regular visits to the doctor, this month is an opportunity to encourage them to seek regular medical advice. Men's Health heightens awareness of preventable health problems with the emphasis of encouraging early detection of prostate cancer. Well, joining us now via Skype is Glenn de Swart. He's the Program Manager for Health for Men. Very good morning to you, Glenn. Thanks very much for joining us. What will you guys be doing to encourage people to make regular visits to the doctor?
Good morning. Yes, men's health-seeking behaviour is quite a complex phenomenon. This month, I think we're going to be focusing on more education than usual. Usually we focus on HIV, people knowing their status and undergoing regular HIV screenings, STIs and so on. But as you pointed out, you mentioned prostatic health, and this month we're also talking about, yes, prostate cancer and testicular cancer. So a slight shift away from merely HIV and STIs.
Now, Glenn, at sort of what age would you encourage people to, or men, to go and have their prostate checked?
From about the age of 45. And it also, you know, some people are more at risk than others. Some men, genetic factors obviously play a role. If you're genetically predisposed, if your father, for instance, had prostatic cancer, regular checkups. I mean, but yeah, from about 45 men, and then testicular cancer, more younger guys from about age 15 upwards. 15 to 25, I would say, is the highest risk there. But if we're focusing on prostate cancer, the risk increases with age.
Now, Glenn, obviously there's a rumour mill that obviously this is not the nicest examination to have. I have personally not been for one. Describe what kind of tests are done when you go for a prostate test.
Okay, you're referring to the digital exam where the doctor inserts his finger up your butt, and men have got some fear, effeminizing event, but there is a blood test, PSA, that they can use to monitor your prostate. That's a prostate-specific antigen test, although recently some of the literature is questioning that. The digital exam, the finger, as I said, which lasts 2 seconds, and then if there is any suspicion, symptoms or whatever, if they detect anything irregular through that exam, then it scans and further tests.
So what you're saying, Glenn, is it's not as intrusive as many people believe it is?
Oh, not at all. I was diagnosed with prostate cancer now during May. So I'm literally going through the process and considering treatment options. And again, like all these conditions, early detection is best. In my case, I'm lucky that it hasn't spread to my bones and elsewhere. And that it's very localized, and now considering treatment options. All men over 45 go and have your prostate checked out. And women, get your men to go if men are too scared. Go with your man. It literally takes 2 seconds. It's not intrusive. The prostate is a few centimeters, literally a few centimeters inside the rectum. It's not invasive at all.
And Glenn, what kind of treatment would people expect to have once diagnosed, if unfortunately diagnosed?
Yeah, there are options. I'm considering 2 main therapies at the moment for myself. There's surgery, which includes the removal of the prostate gland. You don't need the prostate gland to survive. There's also brachytherapy, where they insert, this is quite high-tech stuff, they insert little radioactive beads into the actual prostate gland. So it's the radiation is quite localized. External radiation, yes, certainly, and also hormone therapy. So there are a number of treatment options. And then symptoms can also be treated. The first symptom that I noticed in myself was a slight change in my urination, that the stream of urine wasn't as strong as it had been. And yeah, that's what took me down this path. So those problems can be managed.
Glenn, what kind of sort of lifestyle choices would you advise people to maintain sort of a healthy prostate?
I'm not sure that there's actually anything you can do. Most men, other than getting regular checkups, most men, as they mature, develop some kind of complication related to the prostate gland. I don't think personally, I'm not a specialist, other than being aware, watching your body. Men we're not very aware of our bodies, so being aware of your urinary flow, how frequently you go to the loo, to wee, how many times you wake up in the night, for instance, any changes in that, and going for checkups.
Well, Glenn de Swart, I appreciate your sort of honesty and in-depth conversation here. I'm chatting to Glenn de Swart, Program Manager at Health for Men, a project of Anova Health Institute. We wish you a speedy recovery and good health, Glenn. Thanks very much. Well, on to